Okay, I just want to say hi, and I'm Joanne, your speaker, and I want to thank you for joining us today for our live webinar. This is webinar 2 of 3 in a risk management series this month in May. Our next webinar is May 20th. Okay, today's topic is adapting risk management in a value-based care environment. Okay, the information we're going to cover today and discuss during the webinar, it's for educational purposes only, and it's important not to use it as consulting or legal advice. So please contact a qualified healthcare consultant or attorney in regards to any concerns that you might have in regards to risk management for your organization. I'm Joanne Byron, and I hope you had a chance to attend the live webinar last week addressing the basics of enterprise risk management. This builds on that presentation, but if you didn't, that's okay. I'll fill you in a little bit on the first few slides as we move along and try to provide some of my years of experience to give some insight into the importance of developing a program to enhance safety and quality care. Let's run through today's agenda. In the context of value-based healthcare, enterprise risk management, which was our topic last week, is crucial for identifying, assessing, and mitigating risks related to financial performance, but also to patient safety and operational efficiency, ultimately helping healthcare organizations and providers to achieve their strategic goals and create some value. Today, we're first going to review how adapting to a value-based payment model can benefit your organization and enhance patient safety and quality at the same time, because they're all intertwined now. Our reimbursement models are based on the quality of care. Then we're going to cover how taking this approach can optimize operational efficiency, strengthen financial performance, and cultivate a culture of risk awareness. The final topic is addressing the use of artificial intelligence when managing risk. To summarize last week's presentation, the pressure is on for healthcare organizations to speedily evolve their risk management strategies. Now, this includes rethinking how we collect and share risk information across health systems. Today, most information on risk, quality, and safety, it's difficult to share even within your own organization. And it makes it difficult to organize, report, and take strategic actions, which is a requirement if you are participating in a value-based care model. High-performing organizations recognize the need for a comprehensive organizational view of risk management activities. And those organizations are moving to an enterprise risk management model that integrates risk, safety, and other operational and strategic information all in one place. Traditional risk management, it's no longer sufficient to sustain organizational success in an environment of transforming healthcare delivery and payment. Some statistics I reviewed last week for 2025 indicate that healthcare-related harm, it's a significant concern, with 1 in 10 patients experiencing harm resulting in 250,000 to 400,000 annual deaths due to medical errors. And to repeat myself from last week, we can do better than that. We must do better than that. We have to start taking a more holistic approach to better anticipate, recognize, and address the myriad of risks associated with the increased complexity of transformational change. And with artificial intelligence, there's a lot of change going on. Boards that understand the enterprise risk management systems and its key concepts are going to better be able to manage uncertainty, act as effective stewards and fiduciaries, and focus on the issues critical to creating greater value for their organizations and stakeholders. Value-based care models shift the focus from volume to value with their patients, meaning healthcare organizations are now paid based on patient outcomes and quality of care, not just the number of services provided. Today's presentation focuses on federal government expectations of quality performance, starting with the Office of the Inspector General, or the OIG. Quality and patient safety are now high priorities of HHS, which is Health and Human Services, and the DOJ, the Department of Justice. The OIG and Department of Justice have investigated and settled cases based on the submission of false claims for care that is materially substandard, resulting in death or severe harm to patients. The OIG has entered into CIAs focused on quality of care and patient safety. And the OIG has also issued reports, toolkits, and board guidance related to quality of care. Risk assessment has been added to step number 6 on the OIG's recommended compliance program for providers. That was instituted November of 2023, and this general compliance guidance replaces previous compliance guidances that the OIG has posted on their website. And now they're coming out with specific specialty guidances. They have one on nursing facilities. They're slow to get out the specific ones, so go by the general one, which has the 7 elements. And here it shows that auditing and monitoring isn't sufficient. You've got to start documenting your risk assessments. And addressing the quality of care in your risk assessments is expected. This slide demonstrates the OIG list of common compliance risk areas, which includes traditional billing, coding, how you market and sell, patient incentives, and other arrangements. But quality of care is listed on this short list of high-risk areas. So it's on their radar. Besides patient harm, quality and patient safety concerns, providing excessive or medically unnecessary services can lead to overpayments and may cause False Claims Act liability. Now, I want to talk for just a minute about that. It's hard to conceive that providers would provide excessive or medically unnecessary services on purpose. We all know medical necessity or reasonable and necessary, those are insurance terms. But I have seen cases where there was a cardiologist in Ohio did unnecessary heart procedures for the money on perfectly good hearts. Those are medically unnecessary services, and it caused harm to those patients. Doing unnecessary surgical interventions or medicating patients inappropriately, providing excessive services for turnover, for additional revenue. Those are not just inappropriate and unethical, but it causes harm. The OIG states that your governing board should require regular reports from senior leadership that is responsible for quality and patient safety, and from the compliance officer on oversight of quality and patient safety compliance. And that should all be documented. Who is responsible for heading up quality and patient safety? The board should receive regular reports on the system of internal quality controls, quality assurance monitoring, patient safety, and patient care. The OIG and DOJ have long emphasized the importance of quality and patient safety. Quality and patient safety are often treated as wholly separate and distinct from compliance, but it shouldn't be. The compliance program often does not contain quality and patient safety components, and it should. Quality and safety are integral to the work of Health and Human Services, CMS, the Federal Drug Administration, FDA, and other agencies. Integrating quality and patient safety oversight into compliance processes can alert the entity, your entity, of quality and patient safety concerns. And it gives you the jump. It enables you as an entity to mitigate the risk of patient harm. You want to get ahead of it. You want to know ahead of time, is there a potential for a degradation in the quality of services because of a change that you've made in your organization? Are there patient safety concerns that we can learn from lessons from other organizations that have made mistakes and had to take corrective action? Are we learning from our own mistakes? Are your workforce members feeling safe enough to report concerns, or are they hiding it? The OIG advises providers to incorporate quality and patient safety oversight into their compliance programs. Now, the OIG advising that, it doesn't mean you have to do it, but if you don't, they're going to say, hey, we warned you. We told you that this is something that should be done. This is a responsibility of all healthcare providers. And if you didn't do it, and there's no documentation that you made any efforts, then that's going to go against you if there is harm and there is an investigation. And then nobody wants to pay for those services, then it leads to overpayment situations and can turn into an ugly legal situation. The compliance officer should ultimately be responsible for implementing a compliance program that includes a holistic approach, the quality and safety compliance elements, just as they do for any other compliance risk area that is integral to your entity's healthcare segment. Audits and reviews should include quality and patient safety incidents, conducting root cause analysis, corrective action plans, as well as tracking the effectiveness of those corrective actions. Documenting isn't enough. So an incident happens. You are doing a retrospective review of what happened, how did it happen? You get to the root cause so that you can fix that. You do that by identifying the root cause, developing a corrective action plan, documenting all of that, but then you have to audit and monitor to make sure it stays fixed. Value-based care can optimize operational efficiency in healthcare by shifting the focus from volume of services to the quality and outcomes of care. It ultimately reduces costs and improves the patient experience. This model encourages more efficient use of resources, improved coordination among healthcare professionals, and proactive preventive care, which leads to fewer readmissions to the hospital and less need for expensive interventions. So when we can focus on the key areas that we're about to review in the next few slides, value-based care can lead to more efficient, cost-effective, and patient-centered healthcare systems. Provider costs can be reduced by taking an approach of prevention and efficiency, which is a requirement under value-based care contracts. So if you have a value-based care contract, you've got to have documentation to show what kind of preventive care you're doing. Is it resulting in a potential to reduce readmissions? And it includes an emphasis on preventive measures and early interventions. And those are things that can help the need for more costly reactive treatments later on. And by focusing on improving patient health and providing better care coordination, value based care can reduce the likelihood of patients needing to return to the hospital, which saves a ton of resources. The elimination of unnecessary testing focuses on improved coordination of care and access to comprehensive patient records to reduce the need for repeated or redundant testing, streamlining processes and saving money. Value-based care often uses bundled payments for specific procedures, and that encourages providers to work together to optimize care and manage costs effectively. Now, for providers to work together to optimize care, you have to have your systems in place where information can be exchanged easily. Receiving a single payment for an entire episode of care requires incentivizing coordinated care and reducing fragmentation. Improved coordination and collaboration is promoted in a value-based care model. Interdisciplinary teamwork is needed, as well as collaboration among different healthcare professionals between the physicians, the nurses, the specialists, the therapists, all to ensure that patients receive comprehensive care from a coordinated team. That's time-consuming and it's difficult, and unless you have efficient systems in place and you have invested in some technology to help you achieve this, it's very, very difficult to implement. But you see a lot of organizations getting into value-based care contracts, and if you're not ready for it from a technology standpoint, it's not gonna work well for you. So in order to achieve success, it's critical to have the infrastructure and technology. Electronic health records and other communication tools that can help facilitate seamless information sharing among providers, which helps to reduce medical errors and improve coordination of care. We have to foster a culture of collaboration, respect, and teamwork. Address burnout. If you're not addressing burnout and promoting work-life balance to improve morale and retention, it's all for nothing. Healthcare is stressful right now. We don't have enough physicians, and there is so much stress coming at you from so many different directions. Imposing more work can decentivize people from wanting to collaborate and work together. So get the technology and the infrastructure in place first. We want our patients to feel seen, heard, and cared for, just like you do when you see your doctors. You want to feel seen, you want to feel heard, and you want to feel that the system cares about you. This happens when we take a proactive approach to patient care. Value-based care, it encourages a proactive and preventive approach to care, focusing on the patient's overall health and wellness. And through personalized care plans, not scripted care plans, but personalized care plans instead of templated plans that lack customization, we can better understand each patient's unique needs and preferences. Providers can tailor their care plans to maximize outcomes and improve patient satisfaction. Long waiting periods to be seen leads to an increased emergency room or urgent care visits, which ups the cost. Value-based care may involve initiatives like telehealth, online patient portals, making it easier for patients to access care and engage in their own health management. And those are the types of technologies that we need to look at: telehealth, online portals, reducing wait time. We need to regularly collect and analyze data on patient outcomes, quality metrics, and patient satisfaction to identify areas for improvement. Larger organizations have things in place to be able to achieve this. Smaller organizations, it's a lot more difficult. Data-driven decision-making, that includes performance management and evidence-based practices. Value-based care relies on data and metrics to track outcomes, identify areas of improvement, and reward providers for delivering high-quality care. Data helps provide our physicians and the providers to track key metrics like readmission rates, chronic disease management, and patient satisfaction to assess the impact of their interventions. And by focusing on evidence-based practices, value-based care ensures that providers are using the most effective approach to improve patient outcomes. Implement robust budgeting and cost-controlled measures to optimize resource allocation. By analyzing data, providers can pinpoint areas where care can be optimized, such as identifying gaps in care coordination or inefficiencies in the delivery of services. Data on costs associated with different care pathways can help providers make informed decisions about resource allocation and ensure that care is delivered efficiently. In value-based care models, providers are often incentivized to achieve certain outcomes. Data and metrics provide a way to measure performance and ensure that payments are aligned with positive patient outcomes. To manage the cost of delivering expensive value-based care, our organizations, we have got to focus on improving operational efficiency, leveraging technology, implementing alternative payment models that incentivize cost-effective care. Also, it's imperative to align financial incentives with the goal of cost-effective, high-quality care. Entering into a value-based care agreement requires coordination and a shift in how to get things done. We need to make sure that we involve revenue cycle management to provide staff education. Dealing with value-based care denials in healthcare involves a multi-pronged approach, which includes implementing preventive measures, proactive denial management, and effective appeal strategies. Utilize tools to identify potential errors or missing information before submitting claims. Key steps include educating staff, implementing technology, and collaborating with payers to improve claim accuracy and reduce denials. Track claims and promptly identify denials. Conduct root cause analysis to thoroughly investigate denial reasons and to identify patterns and systemic issues. When it comes to root cause analysis, you see this used often because of sentinel events with Joint Commission accredited or CHAP accredited organizations. But I like to see root cause analysis used more for financial reasons as well, especially when it comes to denials. We want to also prioritize appeals, assess the impact of each denial, and prioritize appeals based on the potential for revenue recovery. A lot of times we don't have the resources we need to follow up on every single underpaid or denied claim. So we want to go after the ones that we feel that we can successfully get turned over from a denial and win the appeal. And we want to go for the big dollar amounts, basically using the Pareto approach of the 80-20. Use technology to automate appeals whenever possible. A lot of your practice management systems have some capabilities. Make sure you have all the capabilities flipped on. Flip those switches. If not, you want to take a look at adding additional technology to help you with that. We want to utilize automated systems to streamline the appeals process, the revenue cycle process, including letter generation and tracking. Value-based care models help an organization strengthen financial performance for all the reasons we've already covered. But it's important to analyze and optimize existing workflows to identify areas of improvement, automation, or elimination. It could be you have too many steps. I did this for an organization that I was working for, and I wasn't looking for a promotion, but I was finding that information that I was sending in to create charges, um, I would follow up on the bigger ticket items to see if they got filed and got paid. And there was like 1 in 20 claims that just never got into the system. And then you get into timely filing issues. And then you want to take a look at what is going on. There were so many steps between my generating the information for the claim to getting it filed that I I did a pretty elaborate flow chart to show all of the areas where something could fail. I ended up getting a promotion from the project, and I did it on my own simply because when you work so hard to make sure that claims are filed for the hard work that our providers are doing, that they get filed and they get paid. And if they didn't get paid, I was all over it to fight that denial and appeal it. And we had 50% of our business being managed care and quality. It wasn't exactly value based, but it's the same principles. So we want to make sure we have efficiency, and having too many steps can actually cause more opportunity for something to fail. So leverage digital tools, automate tasks whenever possible, but follow through to make sure things are operating the way you intended them to operate. We need to improve communication. And while doing that, we have got to find ways to reduce administrative burden. Many organizations are prioritizing agility and adaptability by building risk awareness among all employees, not just those with risk in their title. Risk awareness is the understanding and recognition of potential or actual hazards and the ability to take steps to mitigate or prevent them. Cultivating a culture of risk awareness in healthcare that involves having to empower everyone, all of your workforce, to proactively identify and address potential hazards. It helps to ensure patient safety, financial security, and organizational success. This requires open communication, education, and a commitment from leadership to make risk management a core part of the healthcare organization's culture. So, where do we start? Starts with a top down approach. Leaders need to model risk aware behaviors and make it clear that risk management is a priority. We talked about this last week. You get somebody all excited, a new hire into your organization. They've been waiting and wanting to work for this organization. They're excited. They go through the HIPAA training, the onboarding for compliance, and they learn all kinds of wonderful cultural things. Then they get into their actual job. How long does it take before they see that everything that they were told during their onboarding was just lip service? They don't see it in action. Their boss and their boss's boss are breaking the rules. They're not following what the culture is of what would be expected. People hide mistakes instead of coming forward and saying, "Hey, something's wrong here. I think I screwed it up. What do we need to do to fix it?" So it starts with everyone. It has to start with your top people. If you have a board, it starts with the board and the C-suite. If you are a smaller organization, it starts with your providers and the owners of the company. But your workforce must be able to observe and experience what it is that you're telling them and what you're preaching to them should happen. What should happen should be happening. And when it doesn't happen the way you intended it, that they feel an obligation to come forward and report their concerns without retaliation. We've got to obtain buy-in. If we don't secure support from all levels within the organization, it's just not going to work. If senior leaders are visibly making risk-conscious decisions, others are going to naturally follow and it all falls into place. Very important aspect of risk management is to establish a risk committee. If you're a smaller organization, this might be difficult. You might want to have some outside people actually help participate in a risk committee from a more objective point of view, which can be very eye-opening. Include stakeholders from multiple departments to open lines of communication. And again, technology that can help by centralizing risk information, help to standardize data, and show the relationship between threats. It helps to establish a common risk language and facilitates productive conversations so that you can identify and address all the vulnerabilities, financial, safety. um, uh, The one thing I want to emphasize as well is if you don't address safety concerns and quality concerns with your workforce, because that's where it starts, then it isn't going to pass on to your patients. So you want to have uh, an awareness of what your vulnerabilities are with your actual workforce. And if there's a problem with a vendor, for example, everyone can come together for a quick response to limit the fallout of what potentially could happen because a vendor failed. Clearly delegate responsibility for managing specific risks to individuals or teams. The risk committee should identify the individual who is most closely connected to each specific risk and hold that person accountable for its management. When everyone knows who's responsible for what, there's much less of a chance that something important is going to fall through the cracks. Offer comprehensive training on risk management principles, the procedures, and the organization's risk management framework. And you should have a framework in place. Have a clear, well-defined process for reporting risks. The easier it is to report a concern for your workforce, the more likely employees are going to do it. Guidelines need to be specific and direct. Encourage open communication. Create a safe space for employees to raise concerns and share information about potential risks, promoting a culture of transparency and collaboration. Foster cross-functional collaboration to ensure that all departments are aware of and involved in risk management efforts. Next, create a supportive environment that promotes learning from mistakes. And we make mistakes. Everybody does. We're human. Except when you're in healthcare, a mistake can lead to harm. You can harm a workforce member, you can harm a patient. Encourage employees to report errors and use them as an opportunity to learn, to improve. Reinforce positive, risk-aware behaviors. Take the time to recognize and reward individuals and teams who demonstrate a strong commitment to risk management. And leverage technology to streamline communication, track risks, and improve transparency. Establish metrics that will measure improvement. Implement systems to monitor and measure risk management performance by utilizing technology to measure the improvement and increase transparency. Enterprise risk management technology can gather all risk-related data from claims, internal audits, safety, and third parties in one location. This increases transparency and it elevates the visibility of risk, which will promote a culture of risk awareness across your organization. And it helps to reduce those barriers. Continuously review the organization's risk management framework and make adjustments as needed so that you can stay current with evolving risks and best practices. By implementing these strategies, healthcare organizations can cultivate a culture where risk awareness is ingrained in every aspect of their operations, and it leads to improved patient safety and organization resilience. A great risk culture is not something that can be built in a single all staff email or an all hands on meeting. It takes time. We have to educate people about risk, spark dialogue, and instill a belief that everyone has the power to make a difference. So let's talk about technology and artificial intelligence that can help us with all of this. An AI risk management framework can help you look at risk from three core perspectives to better define which risks to prioritize for attention and mitigation. First is harm to people, which includes harm to an individual's civil liberties, their rights, their physical or psychological safety, or economic opportunity. It also includes group harm, such as discrimination and societal harm. The second addresses harm to your organization's business operation, and that includes security breaches or monetary loss and harm to your reputation. Once your reputation is harmed, it is very hard to get that back. Number 3 is harm to your ecosystem. Your organization, we're all interconnected and interdependent within a community and globally. There can be harm to your supply chain or interrelated systems, to natural resources, the environment, and the planet. To address all these potential harms, it's critical to streamline the ability to create risk identification and assessment. AI algorithms can analyze patient data, medical records, and other relevant information to identify individuals at higher risk for certain conditions or adverse events. We can use predictive analytics. AI very rapidly can predict potential healthcare events, such as medication errors or fall risks, allowing for proactive interventions. Incident reporting and analysis, AI, can automate the process of incident reporting and classification, helping to identify high-risk incidents and trends. And streamlined processes, AI can automate tasks such as data entry, scheduling, billing, freeing up healthcare professionals, not to eliminate their jobs, but so that they have more time to focus on patient care. Improved accuracy. AI can analyze complex data with great speed and a lot more accuracy than humans can, reducing the risk of errors. Regulatory compliance. AI can help ensure that medical devices and practices comply with stringent global regulatory standards. Patient safety. AI can identify and mitigate risks and can significantly improve patient safety and outcomes. Population health management. AI can help manage populations at a higher risk of certain conditions, allowing for more targeted preventive strategies. Personalized treatment plans. AI can help create personalized treatment plans based on individual patient characteristics and risk factors. And AI is being used to accelerate drug discovery and development processes, reducing the time and cost of bringing new treatments to market. While AI offers significant promise in medical risk management, there are also challenges to consider. Data quality and privacy. We have got to ensure the accuracy and security of our patient data. It's crucial for reliable AI applications. Bias and fairness, AI algorithms can reflect biases in the data that they're trained on. So we have to be careful, potentially leading to unfair or inaccurate results. Transparency and explainability, we have to understand how AI algorithms make decisions because it's important for building trust and ensuring accountability. Implementation barriers can be a huge challenge, perhaps even more than when implementing electronic health records during the past decade. Integrating AI into existing healthcare system requires significant investment and training. And there's ethical considerations addressing ethical implications of AI in healthcare. And that includes issues of privacy, autonomy, and access to care. Human supervision, AI should be used as a tool to augment human expertise, not replace it. As a healthcare organization, you should choose an AI risk management framework appropriate to your size and complexity so it's tailored to your specific needs. This is going to help better protect your patients, their data, and your organization's reputation, and to identify and assess risks, including privacy and security risks, the potential for bias and discrimination, and develop mitigation strategies to reduce the likelihood and impact of these risks. It may involve implementing security measures, developing policies to prevent bias and discrimination, and training staff on how to use AI systems responsibly. There's global platforms out there, which is NIST has an artificial intelligent risk management framework, or AIRMF, and ISO 9000, the Information Security Risk Management ISO. So we're going to briefly talk about both of these platforms. NIST stands for the National Institute of Standards and Technology, and you may be familiar with that if you have used NIST standards for HIPAA security purposes. It's a non-regulatory agency under the U.S. Department of Commerce. It plays a crucial role in promoting innovation and industrial competitiveness by developing and maintaining standards and technologies. Now, in collaboration with the private and public sectors, NIST has developed a framework to better manage risks to individuals, organizations, and society associated with artificial intelligence. That's the NIST AI Risk Management Framework. And it's intended for voluntary use and to improve the ability to incorporate trustworthiness considerations into the design, development, use, and evaluation of AI products, services, and systems. So I strongly urge you to have your IT people take a look at this to help you before you decide to move forward with AI technology. The NIST AI Risk Management Framework looks at addressing risk through 4 core functions: govern, map, measure, and manage. So number 1 is to govern, a cross-cutting function that informs and infuses the other 3 functions. 2 is map, where the context is recognized and risks related to context are identified. Number 3 is to measure, which employs quantitative, qualitative, or mixed method tools, techniques, and methodologies to analyze, assess, benchmark, and monitor AI risk and related impacts. And number 4 is managing risks, which are prioritized based on project impact. Manage establishes the context to frame risks related to an AI system and entails allocating risk resources to mapped and measured risks regularly as defined by the govern function. ISO. ISO is the International Organization for Standardization. That's what the ISO stands for. And The International Electrotechnical Commission is the IEC portion of that, and it forms a specialized system of worldwide standardization. National bodies that are members of ISO or IEC participate in the development of international standards through technical committees established by the respective organization to deal with particular fields of technical activity. The ISO and IEC technical committees collaborate in fields of mutual interest. Other international organizations, governmental and non-governmental, in liaison with ISO and IEC also take part in the work. Ensuring patient safety and quality of care is required in a value-based care model. And as you can see, it's very wide scope. Your organization needs to have a reboot, a culture, a holistic approach. If we want to take a more holistic approach with our patients, we have to govern with a holistic approach. We have to get our workforce on board. We have to make sure they're not burned out. We have to have the technology in place. It's a huge ask. Implementing an enterprise risk management program, it's ideal, but it's labor intensive and costly. So consider the advantages of using AI and risk management systems, which can translate into a reduction in the workload of the risk manager, who can devote more time to developing procedures and paths to prevent mistakes, and the healthcare staff, who can spend more time with patients. I really appreciate you taking time out of your busy day to join us on a very important discussion on risk management, ways to implement risk management frameworks, and considerations of using ISO and or NIST as you implement AI to help you identify biases and to implement it appropriately for your organization. Thank you, everyone. Have a wonderful rest of your day.